Welcome to On the Couch with Dr. Chris. I am Christopher Belanci, Medical Director of the National Technical Assistance Network for Children's Behavioral Health, and a practicing child and adolescent psychiatrist at Tufts Medical Center in Boston, Massachusetts. On the Couch with Dr. Chris is a resource of the Clinical Distance Learning series of the TA Network. In the resource you developed for the TA Network, which will be coming out very shortly, you make a distinction between outcomes measurement and outcomes management. Can you tell us what you're referring to?
Yeah, that's a great question, Chris. The big difference is that outcome measurement involves simply measuring outcomes. And so one of the things that folks do when they do a program evaluation or other kinds of activities, or sometimes they're mandated by funders and so forth to measure outcomes. And so they put in a process to make sure that they're collecting information about the impact of their work. And so that's what outcomes measurement is. Outcomes management takes it the next step and says, okay, well, the nature of our work is to help people, and so can we use information about the impact of our work to manage decision making at all levels of the system? So that would include beginning with the family and the youth. So can we use their status as a guide to making good decisions on their behalf and with them, using it at a supervisory level? Can supervisors use the impact of the work to make decisions about how to supervise? At the program level, can you use the information to help design and refine programs? And then at the system level, can you use that as a way of system transformation? So outcomes management is a far more detailed approach to using information than outcomes measurement. Outcomes measurement is simply collecting the information and perhaps reporting it. Outcomes management is using it at all levels of the system simultaneously.
Interesting. So it sounds like there is a role perhaps that youth and parents can or perhaps even should be playing in having a say in the outcomes that are going to get measured?
Absolutely. My view of the world is that everything is a collaboration, that you have to do everything collaboratively and you all come together.
But isn't this research, John? I mean, can we have youth?
No, it's actually, well, it depends on what you mean by research, right? So the European worldview is very much top down, right? There are experts, and experts come in from above and tell the rest of us how things should be. And a lot of research is designed that way, right?
And it's certainly not the paradigm of the system of care.
Because the system of care actually comes from Inuit worldview, right? And in Inuit worldview, because the original wraparound was to help address the needs of families in Alaska, right? And so the Inuit worldview is that the wisdom is in the collective, and that you have to tap into the collective and you pull from that shared vision wisdom. And that's a very different way of thinking about things. And so if you begin to think about research from that frame, then yeah, it's research, but it's not typical of the existing normal science in the US, which really comes from a European worldview.
So how would you meaningfully engage youth and parents in thinking about both outcomes measurement and outcomes management?
Well, there's a whole range of options. I think number one, anytime you create a strategy for tracking outcomes, you make sure that there's good representation of youth and families in that decision process, so that they're a part of that decision about what is the impact, that they can help define what they perceive the impact to be. I think that's incredibly rich and important. I would also go so far to say that actually the actual measurement should include youth and families. And I don't really mean you just give them a questionnaire and ask them. So one of my favorite quotes is from Benjamin Franklin. And he said, "If you tell me, I forget. If you teach me, I remember. If you involve me, I learn." So I think the key here is involvement. And I mean that at every single level simultaneously, that you really involve people in the measurement process. So it's not one person's perspective, it's a common vision. And you use that information in a collaborative way. So it's shared visioning at all levels all the time, and you use that over and over again. So shared visioning at the family level is called engagement. At the program level it's called teaming. At the system level it's called system integration, but it's the same basic concept. And I think families should be at the table for all of it. That being said, I think the other extreme on that continuum would be ask people what they want and do it. And you do have people in the system of care world that think about it that way. The problem with that approach is sometimes families are reaching out to professionals for help because they want to help in understanding what needs to be done. So I think we can't jump to what families want. You can use the family vision, but you have to work through that kind of shared perspective on terms of how things are going. and what needs to be done to be helpful. I think that learning teaching moment at all levels of the system simultaneously is the key to outcomes management, because it's always about learning.
So perhaps if they're actually getting some immediate reinforcement or some close to real time measure of the effect of their work with a young person, or the young person's work on their own issues, or the family's work with the clinician, that might actually even be reinforcing of a willingness to engage in outcomes measurement and management.
Yeah, one of my hobbies is collecting phrases that I find simultaneously stupid and profound, and one of my current favorites is, if you use it, it's useful. And so that's the key.
And the opposite is true. If you just collect data that sits somewhere and doesn't really inform the work in any way,
Right.
people are going to be less inclined to collect the data.
Absolutely. It feels like a waste of time. Because right now, there are millions and millions and millions of families and people helping those families who have taken their good time to document the impact, but we really haven't figured out how to pull that information together and use it, give it back to the people who need it the most.
I mean, it almost sounds like it would necessitate moving the outcomes measurement very close to the clinical encounter.
Yes. It is. My view is it's no different. It's all the same thing. Yeah. That if you're, and when I go to the physician for my blood pressure or my cholesterol, the physician will in fact, guess what, measure my blood pressure, check my cholesterol level, and use that information to make decisions about my treatment. We got to learn to do the same thing. I think we do it, we just don't follow through with the measurement piece of it, right? So that information is really important. And all of us actually try, I think, when we work with people, to use information about the impact of what we've been doing to guide what we're going to be doing. We're finding, for instance, in traditional public mental health, that we're likely to help maybe a little bit more than half of families that present, the youth that present, they get a significant clinical benefit. Now, some people find that number sobering. I find that number a benchmark. That's a starting point, right? And so if you do, for instance, if you have high fidelity wraparound, you're doing it right, you're doing it the way it's intended to be done, about 90% of families benefit.
Wow.
So that says something, right? That says, okay, we can learn from the success of others to help us in our own success. So I don't know any successful person who has not wanted to get feedback in order to be successful. Everybody who's successful seeks feedback. And we need to learn how to seek feedback ourselves, because that's how we're going to be successful.